Gilda's Club Grand Rapids hosting a special panel next week on new advances in prostate cancer care, featuring experts from BAMF Health. This event comes just days after President Joe Biden revealed his own prostate cancer diagnosis, really putting a national spotlight on the disease. And joining us this morning to talk about the panel and why it matters are Dr. Harshad Kulkarni, Dr. Brandon Mancini, and Lindsay Jousma with Gilda's Club. Thank you all for being here. I know this is a very important topic, especially given the news of the president's diagnosis, or I should say the former president. Can we talk about the event? What is this event really aiming to do here?
Thank you, Tanner. Thank you so much for having us this morning. It's wonderful to be here and share with community about Gilda's Club Grand Rapids and our upcoming event. Gilda's Club is a free cancer and grief support community. Everything that happens at Gilda's Club is completely free. And it's a support community for anyone who knows someone living with cancer of any type or knows someone who has died from any cause of death. So we're here for the emotional support for children, adults, families, and friends navigating cancer and navigating grief due to any cause of death. And our support groups are facilitated by master level professionals. We also have social events at Gilda's Club, and we have workshops and lectures which provide education through our wonderful partnerships here with BAMF Health. And that's what we're really here to talk about today, is the exciting upcoming event on Monday, June 2nd, from 6 to 7 p.m. at Gilda's Club Grand Rapids. It is a hybrid event. It's open to the public. All are welcome. We would love to have people here who's connected with the prostate cancer, who would like to learn more about prostate cancer and advances. We welcome everyone to come and check it out. Yeah,
it seems like it's going to be a great panel, especially with some of the experts that you have brought in with you. I want to ask our experts here, because prostate health, I feel like, has been more in the conversation, not just with the diagnosis of President Biden in the recent days, but also just in general over the last several years. Why has that conversation gotten broader over the last few years? Why do you think?
So prostate cancer is very common in men, and many a times men do not pay attention to the warning signs. So events like this really lead to the change, to bring the awareness to the men that it is a fairly common kind of a cancer. You should be aware of those warning signs, get your regular checks done, and also make the community aware about all the advances which are happening in science.
Dr. Mancini, why would you say that this conversation has come up time and time again recently here? I mean, I do feel like it's kind of, the topic has been promoted more for sure.
Yeah, I think just a general awareness of health, and as technology continues to advance, a focus on kind of healthy lifestyle and so forth. Screening, routine maintenance, and healthcare is kind of the baseline way to kind of prevent or screen for a lot of malignancies. Prostate cancer is 1 out of 8 men are diagnosed, 300,000 men in the U.S. per year. And commonly it's something that can be detected early and treated very well. And I think, again, just the focus on healthcare, kind of that evolution in time over the last couple of years has brought this more to light.
Yeah, I definitely think so, especially with other sorts of cancers as well. I really do think that, it's been promoted as a way to, hey, make sure you're getting yourself checked and know the risks associated with all of that. You'll also be covering radiopharmaceuticals and the way that that is changing the way we treat prostate cancer. What exactly is that for our folks at home that may not know what that is? And how does that work? How does that specifically attack the cancer?
So the field of radiopharmaceuticals is really to find the cancer molecule by molecule. We do a scan to find out the cancer at its precise target, and the same target can be actually used to strike. So we actually then also kill the cancer cells cell by cell. So it's really like a missile attack from within, and to kill the cancer cells from within. What's good about this treatment is it is really taking to a precision medicines, or it's precise care. So most of these patients have minimal side effects, and these are really precise. So it spares the normal tissue, and the patients live longer and also better.
Interesting. So I was just, that you answered my follow-up question is, why should people at home care about this? You just answered it there. Living longer, I'm sure, is something that we'd all kind of like to do, especially if you're dealing with something like this. There's also this new, I want to get this right, so I'm going to look at the prompter here, new pre-chemo indication. What is that? Why will you guys be discussing that?
Yeah, so the treatment that we deliver, this precision-based radiopharmaceutical therapy, until literally 2 months ago, was approved to be delivered kind of at the end second line of therapy. So after several lines of treatment, chemotherapy, et cetera. And with the new pre-chemo indication through the FDA approval, now patients can get this more targeted therapy with less side effects before chemotherapy, which is sought after and has been sought after for quite a long time. And it just shows the evolution that is occurring, more targeted therapies, more exactness to prostate cancer and global cancer therapies with less side effects, where chemotherapy will still have a place, but it might continue to move kind of later in the disease course instead of earlier.
It's interesting the amount of advancements that have just happened here recently, but I mean, you think about the grand scheme of things over time, how things have changed and how you guys attack this cancer as well. I want to go back to President Biden. I know that he was just recently diagnosed not very long ago. When somebody in such a prominent role, you know, he's the former president of this country, when someone in such a prominent role like that announces that diagnosis, what does that do for the rest of the public? Is that kind of a wake-up call to everyone else, or maybe a, hey, I might need to go get checked too, because this prominent figure, it could happen to him, it could happen to me?
Absolutely. I think that certainly has raised the awareness, and one of the points why this has come up in the discussion is also because of this particular news. And it really, shows to everyone, all the men, that they should be aware of this particular diagnosis. They should be aware, they should be going to the doctors for frequent checks regularly, get their PSA done regularly, early diagnosis and treatment is really the key. That makes a difference between, how long you live, how better you live, because most of the people can actually live with prostate cancer, right? The key is really you diagnose it early, you do a localized therapy or an active surveillance, and most patients live already good when it's diagnosed early.
Yeah. Lindsay, I want to ask you about the panel. Was this going to always be the topic of this month's panel, or why did you guys decide to focus on prostate health this time around?
That's a great question, Tanner. And our prostate group at Gilda's Club meets every month. So it's a growing group. It meets every month, and it's available right here in our community through hybrid for anyone who's impacted by prostate cancer. And so this is an ongoing monthly support group, and we are thrilled to be able to welcome our friends at BAMF Health and experts here in our local community to share education for people in the community who'd like to come over, maybe haven't checked out Gilda's Club yet for the cancer support. And this is a great opportunity for people to come over and see Gilda's Club and have this wonderful time of education from BAMF Health, as well as our other panelists, and have this time of camaraderie and not feel so alone in this cancer journey.
Yeah, so it's a support group, but I understand that other folks from the community can also come and attend and learn and ask questions as they would like to. What do you hope those community members get out of this as well? I mean, obviously you have the cancer support group for those going through the journey right now, but what about those general community members that are here wondering, about this and what signs to look out for? What do you hope they get out of that?
We welcome everybody to Gilda's Club who is impacted by cancer of any type, or knows someone living with cancer of any type, or knows someone who's died from any cause of death. So our hope is, being a Gilda's Club here in West Michigan for over 24 years, being free of charge for anybody who's impacted by cancer or grief, our hope is that people will realize that they're not so alone in this cancer and grief, and that people can come together and have that sense of community, whether it's through our educational department on Monday, hearing from experts, whether it's for coming to supper together prior to the event to just check out Gilda's Club and see what this is all about, the free cancer and grief support.
All right, and for our doctors here, what do you guys hope people take away from the panel discussion on Monday?
Well, it's really important to be aware that we have got the right treatment for the right patient at the right time. It's right here in Grand Rapids. So it's really important for the people to be aware of not only these disease, but understand all the options. It's about bringing all the health systems together. It's bringing about all the experts from all different medical fields together, and also to know about the cutting edge clinical trials, for example, what are happening right in the backyard.
Wow. Yeah. What do you hope?
Yeah, I mean, I think continued education on what prostate cancer is, what treatments are available, the collaboration that we have between BAMF Health and other community partners in Gilda's Club, The fact that you have all these experts or clinicians that are here to educate and assist on kind of assisting each and every person with their unique journey, whether it means treatment or surveillance, or what is PSA, what are these blood tests, what are these screening things. So just to educate, get people more comfortable, informed, so they can live a longer and happier life.
Yeah, just another question that I have, and I don't know if folks at home are curious about this too. You know, we always hear that there are certain ages we should be doing kind of these checkups, or maybe getting those certain body parts checked. For prostate health, is there a certain age you guys would start to recommend folks start to go in for that?
Yeah, I mean, the American Cancer Society recommends routine screening with a PSA, and a digital rectal exam begins at age 50. There are certain populations, African American population, or patients with, or people with a first-degree relative, like a brother or a father, with a history of prostate cancer, start at 45, and then people start at age 40 if they have multiple first-degree relatives, again, brother, father, etc. And so it is all age-appropriate testing and unique to that person's unique history as well. And so working with their primary care physician is super important. And then other societies have different recommendations as to when that type of screening should stop, but I think specific recommendations and discussion with a physician is the most important, but those are the general ages for starting the screening process.
And just another quick follow-up question. Do you guys see that age in which you guys diagnose somebody with prostate cancer, is that getting younger, or is that staying where we typically find that prostate cancer age range at?
That's a great question. Actually, you know, the average age of diagnosis is 65 at the moment, around about. Obviously, the risk increases with the age.
Sure.
But as the diagnostic modalities are getting more advanced, we are detecting at earlier ages. And as Dr. Mancini said, you know, there are also certain risk factors, like, you know, you could be genetically predisposed to have prostate cancer at an earlier age. So, so age is, of course, just a number, but it's important to really follow the guidelines and be aware of you know, all the options which are existing for early diagnosis.
Absolutely, especially with all of the great clinician work happening here, and like you've mentioned, in our own backyard. I want to ask you, Lindsay, you know, we've got this panel coming up on Monday. What are some other great things happening at Gilda's Club in the near future that we can look forward to? Maybe there's somebody that wants help from you guys, or maybe wants to attend one of your events. What are those, and where can they find those at?
Thanks, Tanner. Anyone who's impacted by cancer of any type, or knows someone living with cancer of any type, or knows someone who's died from any cause of death at any point in their life, is more than welcome to come to Gilda's Club and check us out. If you visit our website, gildasclubgr.org, that's a great way to look at the upcoming events and see what might interest you. If you give us a call at Gilda's Club, we are here. We have social workers ready to speak with you and to talk a little bit more about your cancer or grief situation and help connect you with the support that's available at Gilda's Club for free.
All right. Well, Gilda's Club is an organization that we love to support, so thank you for coming in. Let's get the dates on the screen. Monday, June 2nd at 6 p.m. And did you say there was like a meal beforehand?
Yes, please come at 5:30 for supper.
Okay, very cool. We love to see that. Again, that is at the Gilda's Club Clubhouse in Grand Rapids. We appreciate you guys for your time. Thank you so much for coming in.
Thank you.
Thank you so much.
Tanner.
Yeah.